This is Kimberly Johnson-Simpson reporting for SABC News. We present to you a special mental health report. The upcoming MonWHO conference will see policymakers from around the world convene in Montreal, Canada, to enact useful strategies in grappling with the myriad of challenges of those suffering from mental health issues. SABC will be there. We would now like to focus on a groundbreaking study by prominent Harvard anthropologist Howard Bunderdunder. For the last 15 years, he has been conducting research on schizophrenia in West Africa. His research has focused on how traditional healers have worked with victims of schizophrenia. Schizophrenia affects between 0.5 and 1% of the world population. Joining us by Comlink is Professor Bunderdunder. Professor, welcome.
Thank you. It's a pleasure to be here.
So, Professor, can you tell us what made you decide to study faith healing in Ghana?
I had a PhD student from Accra, and we were discussing how cultures around the world tend to stigmatize mental health issues. Generally, those with mental health issues do not seek care, as their families often disown them. Their communities abandon them. They often find their lives turned upside down. They prefer to live with their problems. However, this student pointed to the fact that faith healers throughout West Africa have, for centuries, been helping those with spiritual issues and demons, issues which are clearly related to mental health. After colleagues from the medical school told me that no research has been done on this subject, I realized that there was an interesting topic of study to be had, and I made plans for what ended up being a very long trip.
We understand your findings have come under fire from Western journalists who don't think African traditional medicine is capable of treating illnesses.
Yes, I have received my fair share of hate mail, but I stand by my findings. I have discussed my research with numerous colleagues, and I have support from every continent.
Your principal conclusion was that faith healers managed to deal with the symptoms of schizophrenia with far greater success than either therapy or pharmaceuticals. Can you give us an example?
One of the major things we looked at was how patients with schizophrenia were able to contribute to society. That is, work, have personal relationships, travel. When we compared our data with information on patients in the United States, we were shocked to find that our African subjects, whose primary care comes from faith healers, were half as likely to commit suicide and twice as likely to retain a full-time job. In fact, the likelihood of coming into contact with law enforcement was lower, and the incidence of self-destructive behavior was significantly lower as well. Basically, in every way, it looked like the faith healers were doing a far better job than Western medicine.
A fertile ground for discourse, for sure. It certainly seems as though your research is injecting a much-needed new perspective into the global understanding of schizophrenia.
Yes, and hopefully further research will be done on traditional healing practices around the world. If my report is any indications, it seems that there's a lot to be learned.
Thank you so much for your time, Dr. Bunderdunder. Your research is fascinating, and we truly appreciate the different perspective you have brought to us.
Thank you for having me.
Your research is fascinating. Well, that is all the time we have available for us right now. We hope this discussion on recent developments in the field of mental health has proven informative and useful. Stay tuned for around-the-clock coverage of the upcoming MonWHO conference. Follow us on YouTube at youtube.com/MonWHO Media and on Twitter at SABC MTL 2015. Thank you and have a nice day.